back. This is Patrick Washington, CEO and co-publisher of the Dallas Weekly, here in Minority Health Month in our special edition of Health. Today, we are talking about heart disease. And with us, we have Dr. James Lemos, who is a Parkland cardiologist and professor of medicine at UT Southwestern Medical Center, and Dr. Quinn Capers, a Parkland interventional cardiologist and professor of internal medicine and associate dean of faculty diversity at UT Southwestern Medical Center, and Dr. Shawna Nesbitt, cardiology medical director, Parkland Hypertension Clinic and associate professor of medicine and associate dean of student affairs at UT Southwestern Medical Center. Thank you all for joining me today.
Thank you.
Thank you.
All right, so I will get right into it. So how prevalent is heart disease, and specifically for the African-American community, how big a concern is it? And I guess I will start with, let's start with you, Dr. Capers.
Well, so heart disease is a tremendous problem, a tremendous burden in the African-American community. Not only is it the leading cause of death, but it is a leading cause of disease and hospitalizations and just unnecessary suffering. And when we look at the Black race compared to other races, heart disease is the leading cause of death in all races, but it tends to happen to Blacks earlier. So Blacks develop that heart disease earlier. They have those heart attacks and strokes earlier. They develop congestive heart failure earlier. So that's a major problem. And there are many reasons for that, but what a good portion of that seems to be a higher burden of what we call risk factors, things that put you at risk for developing heart problems like high blood pressure, diabetes, et cetera.
Okay. And Dr. Lemos, so in the incidence of heart disease, is it greater among African Americans? And if so, why?
Yeah, it is. And, and it varies somewhat depending on what type of heart disease we're talking about. Definitely stroke rates, heart failure rates are much higher in African Americans than in other race ethnic groups. Heart attacks are a little bit higher, but not elevated to the same extent. And then some other forms of heart disease like atrial fibrillation actually occur somewhat less commonly in patients of African American descent.
Okay. Dr. Nesbitt, checkups, and how do we take care of this? How do we check up, and how important is checkups for heart disease? And what does that entail actually?
Yeah, thank you for the question. Checkups is one of the most important things that we can do, because things like hypertension, my particular area of interest, are one of the most common risk factors for cardiovascular disease and for strokes for African Americans at large. And unfortunately, it does not have bounding symptoms. And so one can be walking around living life normally and not have any idea that your blood pressure is not at the ideal level. And so just to make sure everybody knows that is the optimal blood pressure should be 120/80. What we treat to is to try and get your blood pressure below 130/80, ideally, if you're on medications. If you're not on medications and your blood pressures are between 130 and 140, we really want you to understand what is your risk, meaning what are other risk factors like your cholesterol level, like whether or not you have family members who have had heart disease early in life, smoking. All of those risk factors come together to increase your risk for having a heart attack or a stroke. So you can understand that you need a little help to make sure that you're meeting all those criteria. So seeing your doctor is a good thing. In between times, knowing your blood pressure is one of the most important things that you can do. So don't pass by the blood pressure cuff when you see it sitting in the grocery store, in the pharmacy. Sit down and take it. For Christmas, you might consider a blood pressure cuff for the family is a good thing to do. My family got very tired of receiving blood pressure cuffs for me for birthdays and for holidays. But it's an important way to send a message that this is not just an individual message. This is about the entire family. We want grandma around. We want our children to be around, and we want them to be healthy every day of their lives, to live fully.
And let's keep on the family piece, because the family history, and that seems to be a hindrance to some people, even knowing that this is a condition. So for those, and I mean, this might not be a question that anyone can answer, but for those that, you know, might not have family who go to the doctor regularly, how would they even know to look for this, you know? And what are some of the things that people do kind of on a consistent basis that would lead to heart disease, so they could even sort of figure it out?
Yeah, sort of things that people do that would lead to heart disease are smoke, are not eating healthy. You know, salt intake is a really important part of our lives. And I want to just dispel one myth, is that frequently we think that only African Americans eat a lot of salt, but that really isn't true. In fact, the entire country eats a lot of salt. The problem is that African Americans tend to be more sensitive on average to that salt. So it becomes more important for us to be careful about how much salt we're eating every day. And so we want people to read the label. So ideally, you want to be below 2,000 milligrams of sodium per day. And maybe that's too much math to ask you to calculate every moment of the day, but simple things like, instead of buying the vegetables in a can, buy them fresh or frozen. Or instead of buying that packaged, you know, bag of noodles or meal that's been on the shelf for a long time, if it's lasting on the shelf a long time, it has a lot of salt. You can make that assumption because that's what we use to preserve things. Meats that hang in a hot house for a long time, they got a lot of salt. Those are simple things that we can do that change our everyday life. Getting a little more exercise. So maybe you don't park at the closest parking spot to the door. You might park a little further away, get that walk in, counting your steps during the day. All of those things add up to a healthier background of living, which helps you not to develop these conditions so early in life.
Okay, and I want to toss it back to Dr. Capers. And just speaking of all of that, exercise and knowing your healthy living, those seem to be what the social determinants are. And so what effect do social determinants of health have on the prevalence of heart disease in the African American community specifically?
So let me define that for the audience. Social determinants of health, that's how we describe the things like where you and I live, or often for African Americans, where we are allowed to live. In that place where we live, what is the crime rate? Where we go to school, is it a good school? Is the air clean? Is the water clean? All of these things many of them are tied to neighborhood and community and where you live. And these are things that can either give you kind of a head start in life, not only on your road to be successful in a career, but on your road to be healthy and live a long life, because these same things can actually reduce your lifespan if you're on the negative side of those social determinants. So where we live, what we eat, the availability of fresh food as opposed to processed food in that neighborhood, in our reach, those are what we call social determinants of health. And they have a major impact on our health. We've been dealing with, for the last year, seeing higher death rates and higher rates of getting really very ill, like being put on a breathing machine amongst Blacks and Hispanics, as opposed to other races, other groups who get COVID. Well, part of that reason, one of the reasons, is because of a higher rate of, as we talked about, those risk factors, high blood pressure, obesity, diabetes, and that higher prevalence of those diseases in African Americans and Hispanics, putting them at risk for dying from COVID. Often they are influenced very heavily by those social determinants of health, where we live and what's available in our neighborhoods.
To that point, so what is some advice that you would give the African American community to, prevent or even, deter some of these things from happening?
Some of the things that the Dr. Nesbitt was saying, we have to be careful about what we eat. That can be a challenge if you're surrounded by, if all you've got is Burger King and Taco Bell in your neighborhood, and you've got to drive extra miles to go to the market, and get some fresh food, that can be a challenge, but we've got to meet that challenge. We've got to try to get in some exercise every day. And it's important to know that that exercise doesn't have to be, sometimes when we say exercise, people imagine somebody in a gym, what's expensive with nice gym clothes on that they just bought from the store and working up a really big sweat. It doesn't have to be like that. It can be a walk in your neighborhood. A 15-minute or 20-minute walk is so much better for you than sitting on the couch. It helps to keep the arteries clean, keep the blood pressure down, and keep your blood sugar down. So we have to, even though it can be difficult and it can mean making the extra step, we have to make that extra effort to eat better, less fatty fried foods, more fresh fruits and vegetables, and get in a little bit of exercise every day, and then just try our best to manage our stress. It's difficult, but we have to do that if we want to reach our potential and live long lives.
Absolutely, and managing that stress, it's a challenge these days, especially with everything going on. So I'm going to speak a little bit to everyone's expertise a little bit now. So I'm going to start with Dr. Lemos. With all this heart talk, let's talk about exactly what a heart attack is. Can you explain that to the audience?
Sure. A heart attack happens when the heart, which is a muscle pump, is deprived of oxygen in blood. And that usually happens because a cholesterol plaque that's within the wall of the artery breaks open or ruptures, and then a blood clot forms. And that blood clot keeps the blood from getting down to the lower parts of the heart muscle, and some of the heart muscle is injured and dies. And so, and that usually happens because of many of the risk factors that Dr. Nesbitt and Dr. Capers have talked about. The people that are more likely to develop these cholesterol plaques and have the plaques break open are those that have risk factors like high blood pressure or smoking. Type 2 diabetes is a very important one in all ethnicities, but particularly in Black and Hispanic patients in Dallas-Fort Worth. And these risk factors lead to the progression of the plaques, and then the plaques can break open and cause the heart attack. And when people have a heart attack, it's usually comes with symptoms. And unfortunately, too many of us ignore these symptoms or attribute the symptoms to something else. But the most classic symptom is that people will develop a heaviness or a pressure in their chest. Sometimes it goes to the neck. Sometimes it goes down one or both of the arms, more commonly the left arm. But often it's not an overwhelming pain. So people think that a heart attack is supposed to be sort of this severe pain. But in many of us, it's a discomfort or something that can be difficult to separate from indigestion or other types of symptoms. And particularly in older people and often in older women, even the chest pressure or pain itself may be gone, and people may just have weakness, unexplained sweating, or more commonly, difficulty breathing that sort of comes out of nowhere. And any of those symptoms may be a heart attack when you're sitting at rest and not under exertion, and really should prompt medical evaluation. And I think if there's a message I can get out, it's that getting to the hospital early to see a doctor like Dr. Capers, who actually does the emergency treatment for heart attacks, is what's necessary if you think you might be having a heart attack, because there in the hospital, we have all the tools necessary to open the blocked artery and minimize the amount of damage.
I tell you, I kind of want to get up and jog right now. But specifically to the African-American community, are we at any higher or lower risk than anyone else for heart attack? And is there a difference between heart attack and heart failure? And are we at risk for that more as well?
Great question. The patients in the African-American community are at slightly higher risks for having heart attacks, but they tend to present the same way in all race, ethnicities, and really, for the most part, in men and women as well. Heart failure is different. Heart failure is when the muscle itself fails to pump blood to the organs in the body, and sometimes when the blood backs up because the heart can't pump and it fills the lungs with fluid. And heart failure can happen because of a heart attack when the heart is damaged, or commonly it can happen after untreated high blood pressure for many years because the heart gets thickened and weakened. And that is much more common in Black individuals than in Hispanic and white individuals in the US, and is a a real epidemic in the African-American community in the US and in Dallas-Fort Worth is higher rates of heart failure, and unfortunately often seen in relatively younger individuals who may have had untreated high blood pressure for many years.
And finally, are there treatments for this?
There are great treatments for all of these. I think the great news is that rates of death from heart disease across all race ethnicities have dropped. Unfortunately, the gaps between Black patients and white and Hispanic patients hasn't narrowed, but things have gotten better in all race ethnicities over the last 15 or 20 years because of improvements in treatments when people get to medical care. If you don't see a doctor and get your blood pressure treated or get to the interventional cardiologist if you're having a heart attack like Dr. Capers, those therapies aren't beneficial. But once you get there, we've got great treatments for heart attacks. We also have great treatments for heart failure. And over the years, many new treatments have been adopted and shown to be beneficial that can really change things and improve the history and how people do with these conditions. So the news is much better than it was 15 or 20 years ago for living long and enriching lives, even if you have heart disease.
Okay, awesome. And Dr. Nesbitt, Dr. Lemos mentioned that all these conditions can be caused with some, have symptoms that come out of the things that you talked about, like hypertension. Can you please explain what hypertension is?
Sure. So hypertension is really the condition of having high blood pressure consistently. And so for a long period of time, our blood pressure goes up and down every day, and that is a normal variation. But the condition of having elevated blood pressure, that is above 130/80 consistently, is what we call hypertension. And with that comes damage to the blood vessels. And blood vessels are everywhere, so they're in every organ. The most prominent places where we see that damage take hold is in the brain, in the heart, and the kidneys, because obviously blood flow is really important for your brain function. And if the blood vessels are damaged by really high pressure, you could think of it like high pressure inside of pipes, high pressure damages the pipe. And if the pipe breaks, then you have bleeding, and that bleeding is manifest as a stroke in the brain. High pressure in the blood vessels to the heart cause the heart muscle to change in its structure and become weaker. And as Dr. DeLemos explained, you develop heart failure, which is manifest again, shortness of breath and difficulty with doing your normal functions. In the kidneys, the blood vessels, a kidney is basically a big ball of tubes, and they are glass-like tubes. So if the pressure is too high in a glass tube, you're going to break it. And the result of that is ending up on dialysis. So what's the fix? Is to keep the blood pressure controlled. And there are lots of ways that you can do that with lifestyle changes and also with medication. And you got to stay on it. Because one of the problems we have is that, the blood pressure goes up and you don't know it's up unless you check. So you got to stay on it, and you got to actually continue to know what your numbers are.
And I feel like I'm going to ask this question with an answer we all kind of know, but African Americans have a higher rate of hypertension. And if so, why is that?
Absolutely. We have a higher rate of hypertension. That has been a persistent problem as long as we've been watching hypertension as a public health issue. And as Dr. DeLemos mentioned, these things are trending down, but the difference between Blacks and other groups in this country is not, i.e. what we call disparity. And so why? Because hypertension is a result of multiple factors. It's not just one thing. It's not just if you could fix one blood vessel, it would all go away. This is really has some what we call physiologic, meaning things in the body that cause the blood pressure to be higher. Sometimes it can be hormonal. Sometimes it's related to blood vessel issues. Sometimes it's because the kidneys are not working appropriately. But on the outside of it, it has to do with a lot of the factors and the way we live and how we live. And as Dr. Capers mentioned, what we call social determinants of health really impact blood pressure over the long term of your whole life. So if you're living in a neighborhood where you have no sidewalks and you're not actually getting exercise, that impacts your blood pressure and likelihood of blood pressure going higher. If you're living in a neighborhood where your stress level is always on edge because you're concerned about, violence or other threats, the stress level has a physiologic effect on your brain and on your body. If you're living in a neighborhood where food is less available, healthy foods, obviously you're taking in the things that you probably should not on a daily basis. So this is a all around problem that we have to address in a lot of different ways. We've got to think about it at an individual level. How can we take care of ourselves? Because if you don't take care of yourself, you can't help anybody else. And then we've got to do this at a community level, is that we have responsibility for the people we care about that are in our own homes, but are in our neighborhoods, that we want to see them here. And so we have a responsibility to help move that along. And then I think at a societal level is that there's responsibility that each of us bears to look at ways that we can help to move the needle for those social determinants of health. And that's activism, is getting involved, is making your voice heard for what you want to see in your own neighborhood.
Okay, that is a good message. Dr. Capers, what is an interventional cardiologist?
So an interventional cardiologist is a cardiologist who specializes in opening blocked arteries and fixing other problems with the heart mechanically through a tube, through a catheter. So if somebody has a major heart problem, it can be fixed with open heart surgery. Those are heart surgeons that open up the chest and can operate on the heart. Or we can fix these problems through a tube, or called a catheter, that we insert in either the wrist or the groin. And that's what an interventional cardiologist does. So we, through a tube from the wrist or groin, we can actually work in your arteries, open up those blocked arteries. As it's been said, we treat heart attacks by opening up those blocked arteries emergently. And now the field has expanded to treating the heart valves. So you have 4 valves that are like trap doors that open and close in the heart. And we can now fix those with catheter-based procedures. So that's how an interventional cardiologist spends their time.
Okay. And how effective are these interventions?
Very effective, very effective. For treating arteries, they're effective at opening the arteries. Occasionally there's a problem where the artery that we've opened might re-narrow, but with newer devices, that's getting more and more rare. Fixing the heart valves is relatively new, but appears to be very effective. So these are effective treatments, and we're happy to be able to provide them.
And so all this happens, like we've been talking about, with all this stuff that between stress and diet and social determinants. And so someone comes into you and they have to have this procedure. How important is the rehab after heart surgery? Like with all this new technology, how much downtime do people get these days?
Well, a couple of things to say there. So rehabilitation, what we call cardiac rehab, is really supervised exercise for heart patients. So incredibly important for that patient's recovery. In fact, there's evidence that shows patients who have a formal structured rehab program, which is not forever, it's usually just 4 to 6 weeks, but who go through that supervised exercise program after heart surgery or a heart intervention tend to live longer than those who do not. So it's critically important. Most hospitals will have a cardiac rehab program. We want all of our patients who have a procedure to go through these, and that generally is the recommendation. Sometimes, as you might imagine, people cannot, right? Because if it means Monday, Wednesday, and Friday for an hour and a half going to the hospital to be on the treadmill or something like that, I mean, you might have a job that simply doesn't allow that. If that's the case, then we get our cardiac rehab specialist to speak with the patient after the procedure to show you some things that you can do at home. Recovery time is important. One of the things that usually concerns me greatly is when after a heart attack, we're saying to a person who we've opened their arteries, So now they're getting good blood flow to the heart muscle. They got a little bit of heart muscle damage, but that should recover. And when we say, listen, we want you to take 2 weeks off of work, concentrate on listening to what they said in cardiac rehab, concentrate on getting that 20 to 30 minute walk in every day. When they say, I can't, if I do that, if I take 2 weeks off work, I'll get fired. And we hear that a lot. And we hear it a lot with patients of a certain socioeconomic background. We hear it a lot with our minority patients, that they have the kind of job that doesn't have sick leave. You know, when a patient tells me that, when I say, listen, my recommendation is for you to take off 2 weeks. And they say, doc, if I do that, I'll get fired. Well, I don't want them to get fired. So then we kind of make a deal, say, okay, well, you know, do the best you can. Maybe you can be on light duty. But to answer your question, that rehabilitation and recovery after a heart event, like either a heart procedure or a heart attack, is critically important.
Okay, and I guess finally, just this will be a kind of open question, anybody who can answer it. What is the Parkland doing to address these heart concerns in Dallas County? And actually, what does Dallas County's heart health look like right now?
So I will tell you that Parkland is engaged very closely with the county in the county health needs assessment, which was done in 2019 and has embarked on the process of looking at by zip codes, each area of interest. And hypertension is one of them. Diabetes is another. And there are many others that represent diseases that are overrepresented in the population. And particularly developing strategies to look at each and every disease. And hypertension, we're looking at specific area codes or zip codes that will be doing screening events. We'll be coming to the community to bring education. We'll be partnering with some community groups, and we'll be asking members of the community to really become ambassadors of education and of promoting the messages to their constituents and members, but also being folks who get out there and say, here's what we need to do as a community, and then give us feedback about how we can be even more helpful and ways to engage patients into the system of healthcare who may not have a healthcare provider already.
Okay.
You know, and I just add that, you know, for the listeners who have heart disease or think you might, that Parkland has an amazing team of nurses, doctors, amazing facilities that go out to the community that provide the very, very best of cardiovascular care. So we can really help with whatever your heart problem might be, or if you're worried that you might have heart disease. There's a tremendously committed team of individuals, and you know, we're here for you at Parkland, and ready to help in any way we can. And I think that the great thing about the Parkland system and what we're trying to do is build real partnerships with patients, because heart disease is a lifelong condition, and developing these partnerships and relationships that Dr. Nesbitt and Capers have been talking about are what's necessary for people to live what should be long, full, vibrant lives, even with heart disease, if they have it. And I'd make the point that as well, that if we don't see you and you don't come in, then we can't help. And that piece of it, you know, all too often people come in too late in their disease for us to, and we wish that we would have met them 5 or 10 years earlier, when we might have been able to address their high blood pressure or talk to them about weight and exercise before their heart disease became advanced. So we'd love to meet people earlier and partner with them to try to improve their long-term health.
And if I could, I'd like to just stress what Dr. Lemos just said, because I think it's particularly important for the Black community, and particularly important for Black men. I mean, we tend to not want to go to the doctor, right? So many of us grew up thinking that you go to the doctor when something is wrong. And if nothing's wrong, why go to the doctor? But everybody, we want to make a plea, everybody needs to get a checkup once a year, because some of the things that we're talking about here, high cholesterol circulating in your bloodstream, that doesn't cause symptoms until it's too late. As Dr. Nesbitt said, high blood pressure, that doesn't cause symptoms until something bad happens to you. And so getting that checkup every year is really important. Black men in particular are loath to do that. And I've got a confession to make. I'm a Black man and I'm a doctor. And guess what, Dr. Lemos and Dr. Nesbitt? I don't like going to the doctor. Usually my wife has to say, oh, hadn't it been a long time since you've been to the doctor? But even though I don't like going to the doctor, you know, it causes me a little bit of anxiety. When I look at my family, when I look at my children playing, I want to be around for them. And so a trick that I got from my wife, I'll give her the credit. She says, make it a day of the year, every year that you're not going to forget, and say that day is when I make my appointment. So for me, it's my birthday. So every day, every year on my birthday is when I call and make my checkup appointment. But please, Black men in particular, every year get a checkup, because that's how you're going to live a long life. A lot of times we talk about the higher death rate amongst Blacks, and Dr. Lemos just said it perfectly. A lot of times it's because we don't go to the hospital until we're just keeled over in pain, or we can't breathe, or something is terribly wrong. When had you been having a checkup every year, something would have been found to treat you so that you live this long, healthy life. So please pick a year, and maybe it's your anniversary, maybe it's the anniversary of your graduation, maybe it's your birthday, but every day on that year, pick up the phone and call it and make an appointment.
I will echo that, sir, doctor. And because I also am a Black man who does not like to go to the doctor and now have small children and look at them playing, that is exactly how it is. My wife is the one who pushes me, so thank God for wives. But I thank you all, and I will also just reiterate to our audience, please get your checkups. If you've known and followed our brand, you know that my father, the former publisher and now co-publisher, James Washington, wrote extensively about his prostate cancer journey and what getting tested could have done, what the screenings were, what his thought process is. We have kept our eye on health, and we want to do that all throughout this week and month and throughout this year. So thank you all for watching us. Once again, we'll have this and more information on dallasweekly.com, our mobile app and social. You can find us there. And we will be back again tomorrow with more doctors to talk about more health concerns concerning the African-American community. Thank you all again for joining us, and we will see you tomorrow.
Thank you.
Thank you.